The meeting is by 3. Please take notes. It's almost time. Please tell your group members. Meeting is by 3, please. Yes, it's by 3. Okay, please.
I don't want to tell me. I said, let me just withdraw because GT Bank, they disappoint me a lot. Anytime I want to transfer, they will tell me service not available. So just wanted to avoid your stress. Let me just withdraw.
Okay. Good afternoon, everybody. My name is Hussein Mahadi, and I'm the moderator for today's session on JIIPCC Mentorship and Internship Program. Good afternoon. Can you all hear me, please? Kindly indicate if you can hear me. Good afternoon, Rebecca, Rosemary, Uzuamaka, and
Hi, good afternoon. I can hear you.
Emmanuel Falabi. Okay. Thank you for joining us, Mr. Emmanuel Falabi. As we all know, the meeting is being live streamed on YouTube, so we advise all our mentees to put on their videos while in the meeting. Okay, and also edit your name session on the Zoom meeting so that to your name and your surname so that for attendance purposes. Thank you very much as you do so. So today is the 5th week of JIIPCC Mentorship and Internship Program on Health, Tech, and Law, and our mentors for today is Mr. Emmanuel Afolabi and Mr. Collins Akano. Thank you very much. I can see that our mentors are already here with us. Thank you very much for joining us today. And the topic for today is health care business, health tourism, economic evaluation in health and medicine. So we are looking forward to learning from our mentors today and also the presentations from our mentees. So quickly before the program starts proper, I will be taking some announcements and also reading what JIIPCC Mentorship and Internship Program is all about. So JIIPCC Mentorship and Internship Program is a quarterly program for students and young professionals across Africa. Mentees are afforded the opportunity to access valuable advice, training, network mentorship, internship, discussion forums, industry updates, and resource materials from experienced mentors. Program seeks to encourage continuous training, development, and evolution in Nigeria, Africa, and around the world. You can watch JIIPCC videos by searching JIIPCC on YouTube, Facebook, LinkedIn, and the other social medias. So some of the objectives of the program is to provide easy access, guidance, training, and resource materials for students and young professionals in Africa, to facilitate dialogue and network among experienced and less experienced practitioners and stakeholders, to transform mentees into mentors and leaders for the next generation, and finally to facilitate further mentorship, internship, scholarship, and job placement for the mentees. This is JIIPCC is all about. So I'll be taking on the announcements for today. The first announcement, which is the registration for the next quarter of JIIPCC Mentorship and Internship Program, is currently ongoing. If you are interested in any of the courses, you can register through the link, or if you can also share with your colleagues and friends. The next announcement is JIIPCC is having a get-together party by the end of the year, which is going to be holding in Abuja and in Lagos. So in Abuja is the 10th of December, and in Lagos is the 17th of December. So you are all invited. Our mentors will be there. We are also bringing some popular guest artists, so you don't want to miss that day. Lastly, we are going to be having JIIPCC organizes a 30 minutes one-on-one private mentorship with your favorite mentor. Any of you that is interested in further discussion and getting live hacks from any of your favorite mentor, you can register through the link bit.ly/JIIPCCPM, or you can reach out to me or Ms. Juliana, and we'll put you through on how to do that. So those are announcements for today. I will also be letting all our mentees know that you're advised to, by now, I think you should have started already or have enough plans to complete your week 8 project that is coming up front. So please, if you haven't done that, reach out to your group members and start preparation. The week 8 project is an awareness project. I believe we all have detail on that. If you still don't understand it, you can reach out to me or Ms. Juliana. Quickly, I'll be reading out our mentors profile for today before our mentees will take their presentations. So the first mentor for today is Mr. Collins Akano. Mr. Collins Akano is a community nutritionist and health tech entrepreneur with 7 years of experience facilitating nutrition, health and wellness education, nutrition evolution, and accessing lifestyle factors using digital technology. He creates and delivers compelling and engaging presentation on health, nutrition, and lifestyle diseases. Though nutrition education and programming, he aims through nutrition education and programming, he aims to improve people's eating pattern and long-term health, as well as to create sustainable food security in communities. In addition, he co-founded Centerprise Global Resource Limited, a premier personal development organization dedicated to eradicating business mediocrity and enhancing professionalism in Africa, beginning with Nigeria. He is in charge of developing and implementing the overall strategy of the company, as well as overseeing all projects. Thank you very much for joining us today, mentees. You can join me in welcoming Mr. Collins Akano for joining us today. We are very happy to have you with us in our midst, and we look forward to learning from your vast knowledge and experience today. So our second mentor for today will be Mr. Emmanuel Afolabi. So Mr. Emmanuel Afolabi is a product and growth hacker with over 8 years of experience in the health and fintech space, working and consulting with brands such as One Dokita Health, Life Bank, Emergency Response Africa, Market Doctors, Aladdin Digital Bank, amongst others. He has had extensive experience in market research, building customer journey, and creating marketing campaigns, both offline and online, working with marketing budget of up to 20 million and conversion with $0.40. He has implemented strategies that have built organizations from 400 users to over 5,000 users. Wow. Thank you very much for joining us today. Thank you very much for all you do. Our board mentors, we are happy to have you here today, and we'll be moving on to the program proper immediately, and we'll be calling on the leader for group one, or the presenter for group one, sorry, to put on their PowerPoint presentation and also unmute yourself and start your presentation. Kindly note that you have the minimum of 8, maximum of 10 minutes to make your presentation. So please be brief and talk in summary. Thank you. Presenter for group one, kindly unmute yourself immediately. Okay, presenter for group one is Nafisat, and the backup presenter is Daniel Rosemary. Nafisat, are you with us? I can see Nafisat is not with us. So Daniel Rosemary, you are the backup presenter. Please kindly unmute yourself and start your presentation. Thank you very much.
Hi, good afternoon.
Good afternoon.
Can I have like 5 minutes, please? Sorry.
Okay. I think 5 minutes is too much. So please, what are you trying to do? Are you trying to share the screen, or can you hear me?
Yeah, I'm trying to share the screen. I'm trying to upload the presentation to so I can share the screen. Just sorry, please.
Okay. I'm also trying to share the screen on your behalf. So if I can do that immediately, you can just start your presentation, please.
Could you just please share the screen on my behalf? Thank you. Just help me share the screen. Thank you.
Okay, you can start your presentation while I'm trying to share your screen. Thank you.
Hi, good afternoon. Our topic is health business. Sorry, please, I'm waiting for you to share the screen because I need to start it. Did I use my-
Your screen is up now. I think you can start your presentation.
Hi, good afternoon. Our topic for today is businesses in healthcare. And the content will give you the introduction, examples of business and what to invest, and then the legal considerations for what you have to follow to own a business in healthcare, and then conclusion and references. Please, next slide. Thank you. So starting with what is healthcare business? A healthcare business is any entity that provides medical services to patients or provides products or services to providers in healthcare sector. And it can include anything from doctors' offices to companies that sell medical equipment. I think this is self-explanatory, so no need to explain this. We already get the idea as to what a healthcare business is. And then who can own a healthcare business? So anybody with a contrasting academic qualification and work experience apart from the medical line can also set a strong foundation stone in the healthcare business. I'd like to state that for you to own a healthcare business, you have to own a license to actually practice medicine. Like for nursing, they have to get their license to practice nursing. For doctors, simple medical doctors, pharmacists, anyone. So you have to get your license before you can own any business in healthcare, and has to be approved by any of the healthcare agencies. Okay, and then this means that medical professionals and entrepreneurs with an interest in the healthcare industry have access to various business opportunities in the field. Like I state, you have to have your license to own a healthcare business. Next slide, please. So examples of businesses in healthcare. Next slide, sorry.
On the next slide.
Yeah, the next one. Sorry. Thank you. So okay, so we said example of businesses in healthcare. You can own small medical store, a pharmacy, even a hospital. But let's just move to healthcare equipment and services. So one is healthcare equipment and supplies includes companies that manufacture equipment and supplies ranging from the basics such as crutches and bandages to advanced equipment like MRI machines. And then it also includes medical equipment sellers or retailers who provide health-related products either to medical providers or directly to customers. Secondly, healthcare provider and services. So it includes dental clinic, pediatrician clinic, in-home healthcare services, mental health counseling, and wellness coach. So these are people that can provide healthcare services. And like I said earlier, they all have to have their licenses to provide these services before they can be allowed to provide these services. So failure to own a license, a healthcare business license would be regarded as medical fraud or negligence. Secondly, there's a medical massage therapy, medical waste disposal, medical cleaning services, health insurance specialty, and veterinary clinic. Then on the third part, we have healthcare technology, and it includes telehealth software development, healthcare providers database, medical billing software development, medical transcription services, online medical consultancies, and healthcare digital marketing services. So that's actually self-explanatory. No need to explain that. On to the next page, please. Next slide, sorry. So this is just further explaining, should I say, examples of businesses you can own in healthcare. So we have pharmaceuticals, biotechnology, and life sciences. So under the biotechnological business, it's a study of organisms for use, such as GMO plants, chromosomes modification, and the important thing is the production of various vaccines. So these are basically what our biologists and chemists, this is what they do. So they have to test out drugs or vaccines for use, and then those drugs have to be approved by NAFDAC, NDLEA, FDA, and all before it can be distributed. And then it includes companies that perform research and development or manufacturing that are generally derived from living organisms. This business makes it possible for formulation of products such as vaccines, which may be later sold to various affected populations. So just like the coronavirus time or Ebola time, so what the biologists and the chemists, they have to make drugs to certain diseases, and it has to be tested and approved before it can be distributed for human consumption. Then we have the pharmaceuticals. It includes companies that develop and produce drugs and vaccines that are generally derived from a chemical basis, and it also includes retail pharmacy services or businesses. Next slide, sir, please. And then the third one is life sciences tools and services. Self-explanatory. So it includes companies that study living things and provide analytical tools, clinical testing services, and general contract research services. Let me just point out here that these three branches, they work together. The pharmacies, they have to go to they have to test their tools and everything. They have to make sure the drugs is properly tested, and then there's no side effects. So you just can't make a drug without taking it for several testing. So all these things are processes you must follow before you can start distributing a drug for human consumption. Next slide, please. And then investing in the health sector. So because of the intertwining nature of public and private healthcare sector, the sector is often subject to government intervention. Private healthcare companies are incentivized to maximize profit, while the public's objective is to serve the community. So there's the public and the private sector. The public sector are the government-owned healthcare facilities, and the private sectors are the are owned by individuals, and mostly the public-owned healthcare sector, should I say facilities or sectors, are owned by the government, like I said. So now theirs is not for the purpose of gaining profits, but for helping the community, while the private sector is mainly for the purpose of getting profits, also for helping community, but mainly for profits. So that's why most times going to a public-owned healthcare sector is more affordable than a private owned healthcare sector. And then the clashing of goals means that the government must carefully regulate the sector and ensure that citizens can gain adequate access to social services. The presence of political influence in the healthcare sector creates uncertainties for investors, so it is important to monitor policy changes and more. Even with the inherent risks involved, the healthcare sector can be a safe haven and growth opportunity for investors, because demand for healthcare is price inelastic, meaning demand will be relatively stable when prices are fluctuate. The healthcare sector is quite resistant to the ups and downs of. Therefore, healthcare can be a great investment to diversify portfolios. So now, while the private healthcare sector, like I said, most of them are into making profits. So the government actually have to make sure that they are not just into wanting to get profits from their business, but they also have to make sure that everything they are giving to customers are good for consumption. So this is why there are laws that regulate healthcare businesses. Next slide, please. Legal considerations to follow before owning a healthcare business. Like I said earlier, you can't just own a business without being approved. So these are the legal considerations to follow before you can own a healthcare business. The step one is credentializing and licensing. Like I said earlier also, all healthcare businesses, they must have their license to practice, just like how you must have your license to practice law. Same goes for healthcare businesses. You must have your license to practice medicine, and failure to do so would attract punishment. So step one is credentializing and licensing, and it determine insurers and begin determine insurers and begin credentializing. Private insurers require you to credential. Oh my God. Okay, private insurers require, I think there's a typographical error here, but let me just go on. Private insurers require you to credential with them before you can submit claims and be reimbursed. So you need to decide which private and public insurers you will accept. Credentializing can take several months. Prepare the following documentation: that's medical education, residency, and evidence of malpractice insurance. Not all states require malpractice insurance, but it can protect your personal assets in case in the case of patient suing. And then thirdly, determine the public health insurance programs to accept. That's Medicare, Medicaid, TRICARE, and Opt. All these are just steps you have to follow to gain your license to actually have a healthcare business. Next slide, please. Step 2, still further on credentializing and licensing. So this is basically the main thing you actually have to do. The only thing, once you just get your license to actually own a healthcare business, then you just go on to set up your business, and then you make sure that all your drugs are good and they are good for consumption. That's all. So we have determine business structure for tax purposes. Yeah, all businesses have to pay their tax. And then this type of business or corporate structure impacts how your taxes are handled and how much personal liability you carry for lawsuits, debt, and losses. And then there's business documentation. You have to own an attorney for any, not just for healthcare business, whatever business you're doing, you have to own an attorney. Okay, I'm seeing a correction. You have to own an attorney to for in case of any legal suits, maybe from your patients or your clients. And then step 3 is setup. That's organization and management, financial management, hiring staff, and compliance. Compliance part, I think we did healthcare compliance earlier, I think in week 3 or in week 2. So this is where we talked about compliance. Then you have to comply to the rules and regulations that have been stated by the healthcare agencies that to before you can own a healthcare business. So failure to do so, like I said earlier, will attract punishment. They can close down your business for you, or legal suits, imprisonment, or anything. Next slide, please. So conclusion: healthcare is a business like any other. Healthcare is a business like any other business. The healthcare industry stands to benefit from practices that drive innovation and growth. Healthcare providers offer patients a unique service, but that fact alone does not guarantee their success. The service must reflect a solid understanding of how to best interact with consumers and meet their needs. So generally, we already said everything that healthcare business is all about. Is providing services that ensures well-being to your consumers or your patients. So you also have to make sure that you have, and it can also be, it mustn't just be giving them drugs. There's consultation, and then there's wellness, like supplement drugs that are very rich in nutrients and vitamins that helps complete your diet for the day. So this is our topic for today, healthcare business. Thank you.
Thank you very much, Rosemary, Daniel, for that wonderful presentation and self-explanatory and brief. Thank you very much for presenting on behalf of your group. So we'll be calling on the second presenter for group 2. Group 2 presenter, you can unmute yourself. I think I can help you share your screen. So just unmute yourself and you can start your presentation. Okay, presenter for group 2 is Prophet Paul. And the backup presenter is Adelekon Tolulope. So are you with us, Prophet Paul? Yeah, I can see you are in the meeting, so please, we don't have all day. Okay, backup presenter, you can step in if the presenter is not ready. Any member from group 2 can present, please. Any group 2 member, you can step in and present. If group 2 is not presenting, I think we'll move to our mentors' comments and talk. So I'll be calling on our first mentor to give his comments, corrections, and also to mentor us today. So I'll call on Mr. Collins. Mr. Collins, you can unmute yourself and give us your comments while we're waiting for group 2 to present, maybe after your comments. Mr. Collins, can you hear me? Okay, thank you.
Hi, everyone. Yes, I can hear you, Hussein. Can everyone hear me?
Yes, sir.
Yes, sir.
Sorry, I won't be able to use the video right now because my data has some challenges over here. Yeah, I won't be able to use my video for now. I hope that's fine. Can I go on?
Yes, sir.
Okay, thank you very much, Hussein, for the introduction. You did a very good job introducing us on here. And the first group, I love the presentation, even though she was having some challenges at the start, getting everything else said. Thanks to Hussein, who came to rescue her. Yeah, she did a good job presenting about healthcare business. And I just wanted to make a few comments, and nothing serious to correct. Where she talked about the future of healthcare business, she said a lot about licensing and all that, and this is well, currently with the way things are moving, you don't necessarily have to own a healthcare license to run a healthcare business, and this is what I mean. So with the rise of softwares and digital technology in the space of healthcare and medicine, we've seen people who have no education in the healthcare space take up healthcare projects or software tools, and develop these for promoting healthcare in their own space. What do I mean? Take for example the upsurge of telemedicine in every healthcare practitioner space. I hope we can still hear me. Can we all hear me still?
Yes,
I want
sir.
to be sure
We can hear you.
we can hear
We can
me.
hear you, sir.
Okay, so I hope the presenter can hear me, especially.
Yeah, I can hear you.
Hello,
I can hear you.
Rose Daniel, are you there?
Yes, I can hear you.
Okay, great. Okay, so I was saying that with the advent of, okay, great. I said with the advent of no-code tools, software tools, and digital technology, people who are not necessarily doctors are building softwares, are building apps that promote healthcare delivery. Now, if you look at the recent report by McKinsey and Forbes regarding the future of healthcare business, you would see in their report that the future of healthcare is going to be leveraging on three major things. The first one is home care, bringing the healthcare to the people in their homes. That's with the rise of home care doctors, home care nursing personnel, home care services in general, geriatric services. People are bringing the healthcare delivery services to the people's doorstep, the clients, the customers' doorstep. Now, you don't necessarily have to have some healthcare license or credential for you to be, take for example, a stay-at-home aide, or for someone who works with the NHS, for those who do care jobs. For you to be a care worker, there are some minimal orientation you would have to go through. You don't have to be in a credentialed or qualified per se healthcare practitioner, be part of that kind of business. And also, we're defining healthcare business. Rose, I hope you can hear me. We're defining healthcare business. It's also important that you understand the business of healthcare is not necessarily giving healthcare services. What do I mean? A doctor is a is a practitioner, is an expert in a particular field, the field of medical health, of course. But now, for a doctor to give telehealth services, he may need the help of a software developer who is going to build a software tool or a platform for him to be able to render his services to the end user, being the patient or the client, as it were. So now, in the two of these professionals, the person who gives the services and the person who enables the services, they are all part of the healthcare business. I hope we all understand where I'm going to with this. So what I'm trying to say is, bringing the healthcare delivery services to the people at home is a future trend for healthcare businesses. Another one is telemedicine, being able to break the boundaries of distance, break the boundaries of logistics of healthcare equipment and services to the patient. This is a future trend, and I'm talking about telemedicine here. So telemedicine has also changed the way we look at the future of healthcare businesses globally. Okay, so I just wanted to make that contribution to what Rose presented, and let's move on from there, just so that we have that in mind. Thank you very much. And maybe I would drop something else before we are done on this presentation. Thank you.
Thank you very much, sir, for the comments and the corrections. I believe our mates have taken note of that, and we improve on their next presentations. So I will be calling on Mr. Afolabi Emmanuel to give us his own comments. And I don't know, Mr. Afolabi, are you with us?
Hello, good evening. Can you hear me, sir?
Yes, sir, we can hear you. Can we all hear Mr. Afolabi? I can't hear him.
I can't hear him.
Okay, I don't know. I can see Prophet Paul is with us. So are you ready to present on behalf of your group right now?
Hello, sir. Good evening, sir.
Yes, good evening. How are you doing?
I'm very fine, sir. I really apologize for whatever has happened so far. It's because of network constraints, and of course, because of the miscalculation of time. That's advanced because I do not really have the I don't have the PowerPoint presentation ready. But I don't know if anyone in group 2 has the PowerPoint presentation ready and is willing to project it, so I can.
I'll be sharing it for you, so you can just then.
All right. Good evening once again, everyone.
Good evening. We can
All right,
hear
can you hear me, sir?
Yes.
All right, good evening once again. Now, the topic is health tourism, all right? Health tourism. That's what we are putting under view today. Sorry, the next slide, please, sir. All right, so the question basically is, what exactly is health tourism about? So if we try to decomplex the word and we try to separate it, we see health and we see tourism. Now, health, definitely, we know it's talking about something that has to do with the well-being of a person. And then for tourism, we know definitely it means some visits to a place for peculiar reasons. And these reasons may be recreative, they may be for special purposes or for specific purposes. Now, from this slide, we can see that health tourism can be said to be the practice of healthcare providers traveling internationally to deliver healthcare. It can also be when people travel across international boundaries for their healthcare and health needs. Now, discussing this, we know basically that, of course, health tourism most especially it's talking about people who are users, who are consumers of healthcare services. And what they do is that they visit other territories that can afford them with the opportunity or with the opportunities to be able to regulate their well-being, or in cases or in extreme cases wherever they need treatment. Please, the next slide, sir. All right. So we have that although medical tourism is a recent phenomenon, a number of countries like the United Kingdom, Dubai, and many others have actually emerged as active players in the medical tourism business. Why? This is because of the increase in the budgetary allowance of these countries to their health sector. And we can also realize that this is also one of the key parameters that can decide the life expectancy of individuals in the territory. For instance, if we are in a country, for instance, in a country like Nigeria, where we have little to no healthcare services, and for instances where we have healthcare services, we do not have them on an affordable rate, it means that the life expectancy is actually anticipated to drop, because we do not have the necessary facilities, we do not have the necessary or needed budgetary allocation for us to be able to explore the benefits of health tourism in Nigeria. The next slide, sir. And so definitely, the next slide, please.
I think this slide is
Hello, can you hear me?
Types of health tourism.
Hello, can any?
I can hear you. Can you hear me? Can you hear me, Prophet Paul? I don't know. I can't hear Prophet Paul. Can we all hear him?
No, sir.
No, we can't.
Okay. So anybody in group two can continue the presentation on his behalf, or we wait for him to join us again. I also want to recognize the presence of our profound mentor that joined us recently, Mr. Ebenezer Ekwatu. You can see that he joined us. I thought we were supposed to allow him to rest today, but his service in the community, he's restless, so he still chose to join us. Thank you very much for joining us, Mr. Ebenezer. We are so happy to have you here. So group one was presented already before you joined us. So I think it's group two that is actually presenting, but I think Prophet Paul's network is fluctuating. So we are going to be taking the comments from Mr. Afolabi Emmanuel again. I think his network too is fluctuating, but we are giving him the platform now to give us his comments before Mr. Ebenezer that just joined us. Mr. Afolabi, can you hear me?
Okay. Hi, good afternoon.
Good afternoon.
Can you hear me? Okay, better.
Yes,
Hi, good afternoon. Sorry, I think it's network. So the first presentation that I saw very well, I want to say an excellent work there. So I think I heard Collins mention it quite a little bit early that already that because of the evolving way in which healthcare technology is changing, sometimes okay, sorry. So sometimes we see that the adoption of healthcare resources versus technology resources is quite not balanced. This is where I'm going to come from. For example, if we are saying a doctor is the only person who can start a healthcare business, right? We've evolved beyond that stage. An example is even huge companies such as 54 Gene was not even started by somebody who was a medical student, no, but it has evolved. So healthcare technology on its own self, right, necessarily does not mean that someone who has a healthcare background starts up. I think a mention was made by someone who said we have telemedicine programs now. We have programs in which you can just sit in your house, request for ambulances, and most of these platforms are even built by individuals who, in themselves, were not doctors or even go to study medical field, even though eventually maybe they decide to go and study some form of course in public health. But one thing we should very well note is that because of how healthcare technology is evolving, the fact that someone has to be medically inclined to start up such a business is no longer that way. But all in all, the presentation was very excellent, and I hope my network doesn't show me out again. So I don't know if the group 2 has presented.
Yeah, the group 2 started their presentation, but I think the network was not allowing him to continue. I think he's joined us now, and we can also ask him to continue his presentation. Prophet Paul, can you hear me? Prophet Paul, you can start your presentation. I can see you are raising your hand. I think he's not responding. Okay, so
What of the backup presenter for group 2?
The backup presenter is Adili Kantolulope. Are you with us in the meeting? I don't think she's with us. The backup presenter is not in the meeting, so
okay.
I'll be calling on Mr. Ebenezer to give us some of his insights on the topic for today. I know he missed the first presentation. The topic for today is healthcare business, health tourism, economic evaluation in health and medicine. So Mr. Ebenezer, I don't know if you have one or two things you want to chip in before we proceed.
Hello, good afternoon, everyone.
Good afternoon, sir.
Today I am a student, so I am just here to learn. Thank you.
Okay, sir.
It's okay.
I think I'll call on Mr. Collins again. I think he said he has something to chip in at the end before we move to the question and answer session.
Okay. Hi, everyone. And thank you again for having me. You're welcome, Mr. Egwatu. Yeah, I learned you're one of the previous mentors. You're welcome. It's nice to have you here. And I stand on
Thank you, my brother. Thank you.
Yes, I stand on what he said. We are all students. We are all learners in this world. Globally, we are all students. Okay, so I wanted to add something to what the first presenter did. She did a remarkable presentation, like I said before. I wanted to add something. Now, when we talk about health business and even health tourism, like the Prophet was presenting, we need to understand that, first of all, when we are trying to create solutions, like Emmanuel reiterated when I mentioned the telemedicine part. Telemedicine is a future trend when it comes to healthcare business because it helps to cut down the cost of healthcare delivery services. Prophet Paul was about to present, or he was already presenting on health tourism. The reason why I think I have to make this comment is that both healthcare businesses, which health tourism is a healthcare business, all need to leverage on the fact that for a country like Nigeria, a developing country like Nigeria, that is majorly plagued with poverty, like the majority of Nigeria's population is poor. We are still trying to fight to achieve universal health coverage for Nigeria's population that is living in poverty. I mean the majority of the population living in poverty. So when we talk about healthcare businesses, if we are looking to start a healthcare business that will thrive in a nation like Nigeria, first of all, the cost for healthcare delivery needs to be checked. That has to be a very predominant factor in setting up a healthcare business in a country like Nigeria or in any other developing countries in Africa. Now, healthcare tourism is not seriously happening in Nigeria. It may have been happening before when we had the foreigners come deliver their children in places like the teaching hospital in UI, University of Ibadan, and other places. Back then, when the country was, the nation had, some stability when it comes to human development index, things like healthcare, education, and all of those things. Now, but for the current state of things, you don't talk about healthcare businesses, and you're not talking about something that is going to be cost effective, that will cut the cost to the barest minimum. Then healthcare tourism. Nigeria is not fit to discuss healthcare tourism when it comes to, we can't come to that table to discuss healthcare tourism, because if you check very well, even things like retail health insurances are not even doing very well in our country. I know, because I was a strategic business manager for a retail health company about 5 years ago, and we couldn't find our feet. We went everywhere, we couldn't find our feet, because people couldn't even keep out a small amount, a fraction. I'm talking maybe 1,000 naira less a month for their healthcare insurance policy activation. That's how serious it is. So we are talking about right now, what we are talking about, instead of healthcare tourism, what we're talking about in Nigeria is community-based health intervention. It's still an intervention we're talking about here. It's not yet tourism per se. India, Dubai, like the Prophet Paul mentioned, Dubai, yes, Middle East, US, Singapore, Malaysia, South Africa, these guys can talk about healthcare tourism, because that's the functioning of a society or an economy where healthcare is paramount, healthcare is prioritized. In Nigeria, we're looking for universal health coverage because of the vast majority of Nigeria's population living in poverty. And this poverty is especially severe in rural areas. You won't say Lagos, because you may not say, but there are some places in Lagos that are quite remote that are going through this as well. When people in rural communities are sick, the first and nearest health facility they visit is the primary healthcare center. How many primary healthcare centers are functioning? So you can see the reason why telemedicine is taking the front burner, because now software developers are building these wonderful, amazing, intuitive platforms where people can just book a doctor straight up. The doctor gives you a video call, breaching the whole distance of having to travel from here to Singapore to see a doctor who's an expert in fertility, for example, or from here to Malaysia to do a bariatric surgery when over Zoom, like we are here now. I'm currently talking on a platform where we have 14 people active here, including Juliana, who we spoke yesterday, and it's as though we are all interacting. We can share things and watch a screen. So these are the things we are talking about. These are the issues as well. Healthcare business, great. You mustn't be a doctor or a healthcare licensed practitioner to run a healthcare business. By the way, I hope you know that when it comes to business, a business is something that runs independent of you. It means you've set up a system that works towards a goal or a product or a service rendered, and it can work independent of you. That's a business. You can set up positions for people, and those people do their positions and their responsibilities towards a common organizational goal. That's a business. But if you are there for the business to function, you are the business. So if the doctor needs to be there to do the surgery, the doctor is the business. But if the doctor has a platform, or the doctor is on a platform where people can book video lessons, book video consultations, that platform is the business. Now, for healthcare tourism that Prophet Paul was going to be presenting on, healthcare business, health tourism is not even a question for a Nigerian place right now. It's not a question for most African countries. We are not yet in the healthcare tourism space. What we are trying to first of all achieve is universal health coverage. Thank you very much.
Thank you very much, Mr. Collins Akano, for giving us more insight on the topic and also explaining everything to us. Okay, I can see that Prophet Paul is with us now, so I'll still give him the opportunity to complete his presentation before we move to the question and answer session. So Prophet Paul, if you can hear me, kindly unmute yourself. and continue your presentation. I'm waiting for you, Prophet Paul. Okay, Prophet Paul is not answering me, so we are going to be asking our mentees if any of them are having live questions. All the mentees that are with us, including Mr. Ebenezer. If you have any live question for our mentors for today, Mr. Collins and Mr. Emmanuel, so you can just raise your hand and I'll call on you to ask your questions quickly. Okay, I can't see any hands yet, so we are all advised to put on our videos. We are currently in the picture time session, so we want to take some screenshots. This is for our mentees to post on their social media handles, tagging their friends and our mentors and saying a thing or two that they learned about today's session. So we are taking the picture time. We advise everybody to put on their videos. Thank you as you do so. Okay, please, we can all smile while I'm taking the screenshots. Thank you. Okay, I got that. Thank you very much. I will slowly be calling on I'll be calling on Mr. Emmanuel Afolabi if he has any comments, any final comments before I'll be asking the questions that were sent in by our mentees. And if you have any live question, you can raise your hand. I'm seeing the screen and I'll call on you to ask your questions. So Mr. Emmanuel, okay, I think Mr. Emmanuel is now in the meeting again. He's still having the network issues. So quickly, I'll be posting the questions on the chat box and also asking the questions to our mentors. Okay, please give me a minute to do that. Okay, I think we can just turn on our video again. The first picture, I think we didn't capture our mentor, so I would like us to capture our mentor. So please, if you've turned your video on before, you can kindly do that again, please. Thank you. Thank you very much. Okay. Okay, yeah, I got it. Thank you. Okay, so I'll be asking the questions. The first question, Mr. Colin, I hope you can hear me clearly. The first question is, how do you see the future of healthcare business in Nigeria also? How do you see the future of healthcare business?
Okay, is that question for me?
Yes, this question is for you, sir.
Hi, Hussein. Okay. Okay. Well, I see the future of healthcare business in the light that most apps are going to come out with the rise of no-code tools right now. There's something called no-code without basic knowledge of coding. People are actually building softwares that would bring some services to us with less hassles. So I'm seeing that telemedicine will be well adopted. Home care delivery services are going to be well adopted. In the wake of COVID, what we've seen is that there's a lot we can actually do with digital technology as opposed to the traditional ways we do things. I'm talking this before COVID, most people would not even do a meeting such as a Zoom call like this. But the COVID just, more like reset everybody's and made us understand, come, digital technology is here to make things faster for us. It's not for us to, always have to go through. Nobody wants to be waiting in long lines now at hospitals, waiting to see the doctor. Nobody wants that. People want to be able to check in, just like how you're taking a flight to maybe Kaduna or something, or Abuja, and you can check in into the flight right from the house or from your app on your phone. Nobody just wants to come and sit in the hospital for long hours waiting to see the doctor. So I think the future of healthcare businesses will really be disrupted, whereby a lot of technological advancements are going to take place in the healthcare delivery system. So yeah, I believe Nigeria is well positioned for that with the rise of digital technology and content creation and all of that. I believe there's a very bright future for healthcare business in Nigeria and Africa.
Thank you very much for answering that question. So our second mentor is not with us. We would have loved to get some answer or contributions from him on that question too. So I'll be asking you the next question. Next question is, what are the primary concerns in the healthcare business?
I think for me, the primary concern is how we can actually, so when everything goes digital, it raises the concern of privacy. We've all noticed that back in the years, when things happen, we all watch it on the national news live channel on TV at night. There's a particular time of the day when they will watch what is going on nationally or globally. But now, with the wake of social media, digital technology, we get the information as it's happening. In fact, the streaming has made it even much more closer to us. So I think the concern, when all of these things are facilitated in this regard, the concern will be privacy and verification. The issues we're going to be having in the future for healthcare will be the privacy of patients' information, and also the level of verification, fact checking. These are going to be concerns for healthcare businesses, because if things are postulated to the general public and they are not fact checked for whether it's from a verified source, it could create some kind of tension with people who are getting these information that are not verified. So that will be a problem. Another issue is that when patients share information with their healthcare practitioners, they stand the risk of these informations being hacked, because of it's being sent in the clouds, or as people say. So there's an issue of privacy. There's an issue of fact checking for information from verified sources. So these are the two concerns that spring to mind right now. If I remember any other thing, I would share in the course of time. Yeah.
Okay, thank you very much. I'll be taking on the last question. Kindly note that if you have any question, you can raise your hand and I'll ask our mentor. I'll call on you to ask your questions. So I'll be taking the last question. Can a health business be privately owned without interference from the government? That's the third question, sir.
Okay, yes. A healthcare business can be privately owned. Yes, very, very certainly. A healthcare business can be privately owned. But when it comes to government interference here, I need to understand, what do you mean government interference? Do you mean in the space of where the healthcare business isn't paying taxes to the government, or do you mean in terms of regulation for their services? If you're talking about a privately owned hospital needs to also still be registered with the healthcare bodies that regulate hospitals in Nigeria, for example. Yeah, so that might be a part where you may say, okay, the government is interfering here, but I don't think it's an interference. I think it's just a regulation that has been put in place to be able to, have every person have like a modus operandi, a mode of operation just for regulation purposes. It's not like it's going to infringe on their service delivery, if you ask me. Yeah. And then privately, if a healthcare business can be privately owned, if you have been listening to what I've been saying concerning apps and telemedicine and all of that, a startup founder can actually launch an app that necessitates the promotion of health in a particular community or in a particular regard. Like, take for example, I'm a community nutritionist and I run a platform that is a digital platform for nutritionists and dietitians, as well as fitness practitioners in Nigeria and Africa. I run that platform. I don't have any kind of interference from the government as regards how I discharge my duties as a nutritionist. What I owe to a body is the Nutrition Society of Nigeria, where all nutrition practitioners and professionals have like a modus operandi, how we consult clients, how we prepare meal plans. But I don't think the government has any stake in how my meal plans are being disseminated to my clients. For example, I'm just giving you an instance of what I mean by you can have a privately owned healthcare business without the interference of government, except if it is a regulation we're talking about. And then, of course, the government has a hand in that, or the government should have a hand in that. Thank you. Hello, is everyone there?
Yes,
I'm
we're
sorry,
here.
I was muted. Thank you very much, sir.
Okay.
Prophet Paul was raising his hand, so I'll call on him to give us his own questions. Prophet Paul, can you?
Hello, sir. Can you hear me, sir?
Yes, we can hear you.
All right. My question is just this. Now, with in a bid to project Nigeria to the health tourism scene on an international level, of course, we know that it's not going to be it's not going to be a walk in the park. But what would you suggest should be the measure to be able to push Nigeria into that realm? Would you suggest a private-public partnership? Would you suggest a government-run kind of system? Would you rather suggest a
Prophet Paul, I think your network is breaking, so I don't know, did you get the question or you should take it again? Mr. Collins, are you with us?
So sorry, I would like him to take the question again. I don't think I got all of it.
Yes, so Prophet Paul.
All right, can you hear me, sir?
Yes, I can hear you, Paul. I can hear
All
you.
right, the question is this. Now, we know definitely that trying to push Nigeria into health tourism, I mean, making it an actual health tourism destination, is not going to be a walk in the park experience. However, what would you suggest should be the best measure to be able to make Nigeria level up? Would you suggest a privatized healthcare system, a public-private partnership, or a public-funded healthcare system? Which would you suggest, sir?
Okay, yeah, thank you very much, Prophet Paul, for that question. It was very timely. In fact, if you had finished your presentation, I would have brought up this question myself. So thank you very much for asking it. I am someone who, okay, I was telling earlier, hello, Paul, can you hear me? Especially you, Paul, can you hear me?
Yes, I can hear you, sir. Yes, sir.
Okay, yeah, okay, yeah. So I was saying before that I'm a community nutritionist, and one of the things I champion as a community nutritionist is a collective effort towards nutrition intervention in Nigeria, in Africa. A collective effort, please underline that, collective effort. Now, I would say the best approach to put Nigeria on the map when it comes to, okay, I hope we can all see me too. So I would say the best approach to put Nigeria on the map when it comes to medical health tourism is a partnership, a private-public partnership. That's going to be one of the best approaches. What do I mean? There's a role the individual, the community individual needs to play. There's a role the government has to play. Community-based health intervention is the future for getting a place that is not a destination for medical tourism to be that top spot. The government has a role to play. The people have a role to play. Now, take for example, Nigeria. For Nigeria to achieve this universal health coverage that I'm telling you about, there needs to be community-based health intervention. And where is this community-based health intervention happening? It's happening at the primary health care centers. I'm part of an organization. It's called Make Our Hospital Work, MOHW, Make Our Hospital Work. It's led by Dr. Lars. Now, in this organization, what we've been able to do is to give the responsibility of making primary healthcare centers work. We gave it to the people, to the locals of the community. So if I come to your community and I look at the primary healthcare center in your community and it's nothing to write home about, you guys in that community, the bulk of the work lies with you. I hope we are understanding what I'm trying to say here. It has to be community-based.
Yes, sir.
When the primary healthcare centers work, it wouldn't take long. The private healthcare centers start to pick up. It wouldn't take long. The tertiary and all of that, everybody starts to come up, but it needs to come from the grassroots level, and that's the primary healthcare centers. So the government has to, yes, of course, provide equipment, provide staff, pay staff, but then the community health workers are the ones that will make community members come to the primary health care center and not just self-medicate at home. Make sure that, oh, okay, these equipment have been donated to us by the government. We need to keep this equipment working. There's something called, in the COVID time, we noticed people were hoarding palliatives that were donated by international bodies for people were being hoarded by private individuals, by government officials, and in fact, some of them even branded it as souvenirs for their personal events. That's to show you the decadence, in the situation when it comes to accountability. So we have a role to play as people, and the government has a role. Yes, private and public health partnerships will be a good route towards putting us in the map for medical tourism in Nigeria. Thank you.
Thank you very much, sir. I believe we all understand how Mr. Collins took his time to explain that question. Prophet Paul, can you hear me? I hope you understand. I hope he answered your question.
Yes, I do understand, sir. I do understand, sir.
Okay,
Hussein, at this point, I would want to. Hello?
Okay, sir.
At this point,
okay, sir. The floor is yours, sir.
Hello, can you hear me?
Yes, we can hear you.
Okay, good evening, everyone. I didn't want to talk. I wanted to just be a student and learn. But the question that was asked is very germane, very important and timely. And beyond okay, let me greet my brother first. Collins, I greet you. Good to see your face.
I greet you. I greet you, Mr. I greet you.
I'm the team lead for Make Our Hospital Work. I'm the Lego team lead. No, I don't want to start a video.
Okay, sir.
Hello?
Okay,
yes,
sir. Okay,
I'm at home. I just came in now. I'm trying to unwind, but I was following this thing. I'm the legal team lead for Make campaign. So I totally understand what Collins was saying, the role of the community. But then for Nigeria to become a health tourism hub, there is a lot that the government has to do, one of which is security. Do you know why Nigerians go abroad to get treated? Beyond the advanced healthcare facility they have and all that, the primary thing is security. Our country as it is today, given what we are facing today as Nigerians, do you think that if people begin to come here to get medical, let's assume that we have put our hospitals in place, let's assume that we have done everything, do you think that people can really be coming to Nigeria for treatment? How many people go to Syria and Iraq and Afghanistan for whatever business? I don't know if I'm making sense to you. So, can anyone hear me, please?
Yes, we
sir,
can hear
hear
you.
you. Nobody goes
Okay,
to
so-
Iraq. Nobody goes to Syria.
So the primary responsibility of government is to make the environment secured such that we do not have foreigners who come to Nigeria for treatment getting kidnapped. And they are now calling it becomes a case of double jeopardy, or what Fela will call double wahala. Someone is sick and comes for treatment and the person gets kidnapped. The family will be raising money for to pay her hospital bill, but they will first of all have to pay kidnappers to release their family member alive to go and receive hospital treatments. So healthcare tourism is laudable, is foreign income earner for any nation. But then for Nigeria to get there, a few business people can bring money out to build hospitals, get facilities, the community can do what they need to do. But for that business to thrive and become sustainable, we have to have a secured environment nationwide, because it's not going to be one hospital sited in Abuja only to be overcrowded. Once you know Nigerians, anything that brings money, everybody will put head there. So if healthcare tourism begins to boom, you will see our politicians establishing hospitals. You will see our oil magnates establishing hospitals. But the challenge is the government needs to secure the environment first. I needed to put that in so that whoever is thinking along that line should also consider it, because it is a major factor. Thank you very much.
Thank you very much, Mr. Ebenezer, for your comments on Mr. Collins' answers. So we have come to the end of the program now, and I'll be giving the floor to Ms. Juliana to tell us a thing or two, give us the vote of thanks, mainly, before we end the program. Ms. Juliana, are you with us?
Yes, I'm here. Thank you very much. Thank you.
Ms. Juliana, I think your voice is breaking. We can barely hear you.
Ebenezer, and thank you, Scott. Hear me now?
Yes, we can hear you now.
Okay, so I was saying that thank you so much, Mr. Collins, Mr. Ebenezer, Mr. Emmanuel, and Hussein for today. I think that the session was really amazing and interesting. And thank you also to the mentees for researching and for putting your presentations together. I think that today's topic is very timely, considering the fact that we have a lot of our leaders traveling out of the country for healthcare. So we've had like our president, our governors, and even those that are about to contest for elections here, traveling out for medical healthcare. So that's tourism, that's financing and empowering another person that we in Nigeria and those of us that are not Nigerians also on this call can also think about writing articles on talking about, so that we in Africa can develop our own system and not we should also be asking ourselves the question, why are our leaders so eager to get their treatments outside Nigeria, considering the fact that we have a lot of very expensive and well-built hospitals here in Nigeria. We have a lot of them in Abuja, we have a lot of them in Lagos.
Please, can you give me big letter?
Thank you very much.
Oh, sorry. So we have a lot. Yes. So we have a lot of them in Abuja. We have a lot of them in Lagos. Yes, we still have our leaders traveling out of the country for their treatment. So I think this is something that I will encourage the mentees to write about, and those who advocate for health and in the health industry to also keep talking about, so that we build our own system. Thank you so much, everyone, for today. Today has been amazing, taking out the time to be with us. We really appreciate it. And thank you to Mr. Ebenezer for lending his voice to this topic and for joining us also. So with that, we've come to the end of the session for today. Thank you, everyone, and have an amazing day. Bye.